What are some of the symptoms that patients with cancer should be looking for?
Well, I think the symptoms that you need to be looking for are varied. The difficulty with clots is that they can range from having no symptoms to having such severe symptoms that you pass out and become unconscious. But if we start from the beginning, so clots usually form in the legs, in the deep veins of the legs. So it's called a deep vein thrombosis. And what that clot will do is it will block the drainage of blood from the legs back into the body. So it may cause a back pressure of blood. The common things we'll see will be pain in the leg, often pain in the back of the leg, in the back of the knee or the calf. There may be swelling, and that may be in the calf or it may be the whole leg. You may get redness. They call that erythema. So you may get one of those, you may get a mixture of them. But I think if someone is getting pain in one of their legs or swelling in their legs during chemotherapy or during their cancer journey, they should have a low threshold for seeking medical attention. I don't remember the number of patients who've come to me and said, I think I have a clot, and they didn't. But I certainly remember the patients who never mentioned it and then come with a large clot or come very sick because they didn't have the clot treated. Now, the clot in the leg, the deep vein thrombosis, if untreated, may then get bigger and pieces may break off and travel through the bloodstream and end up at the lungs. And that's called a pulmonary embolus. Now, depending on the size of the clot that goes to the lungs, may determine symptoms there. Symptoms may be breathlessness, there may be pain, chest pain, they may cough up blood, and a large clot, which is big enough to actually obstruct blood flow through the lungs, could leave you to pass out or could even be fatal. So that's why we take clots in the legs seriously, because we are wanting to prevent a blood clot on the lungs. However, 80% of clots on the lungs will be in people who've had no symptoms in the legs at all. So someone saying, well, the legs were fine, this can't be a lung clot, it can't be a pulmonary embolism, that's nonsense. Now, the difficulty is that if you say to a cancer patient, have you felt breathless? They often do, because there are lots of things associated with cancer that can make you breathless. You could have a chest infection, you could be anemic, you may have developed fluid on the lungs, you may even have tumour on the lungs which is making you breathless. You may already have a lung condition that you normally feel breathless with. But my advice is if anyone has breathlessness which doesn't have an obvious explanation, or their breathing has changed, it's something that needs to be looked at and needs to be ruled out in the very least.